G'day guys, Brad Domek here, Director of Specialised Health, and I'm just walking out of my office in Manly, and the reason is that I have to go and move my car. And some people might think that having to move your car every couple of hours is a big negative because it's annoying and it disrupts your workday. I, however, have spun this to find a bit of a positive in it. And that positive is that I get to break my seated position because I'm sitting down in front of the computer all day when I'm not out treating clients, and I typically, like everybody else, get jammed up hip flexors and pulls my pelvis forward, and as a result you get that non-specific lower back pain where you get the tightness across your lower back. Regardless of how active you are, regardless of how mobile you are and flexible and whatnot, if you're sitting all day, you can't get around the fact that your hip flexors are going to tighten up. So I thought I would just put this little video out to explain one of the exercises that I've been having a lot of success with myself in terms of combating that seated position, and B, I've had a lot of success with prescribing for clients who have lower back pain as well, but maybe for other reasons, such as from developing a protruding disc, or from an MVA, or not generalized, non-specific, soft tissue pain in the lower back. It's still a good stretch for whatever the reason was that they've developed this lower back pain. So it's called the couch stretch, and I'll show a picture of it here. And essentially, this is the first iteration of it, actually, where it's more of just the pure hip flexor stretch. So within your hip, they have the iliacus is a main hip flexor. The psoas muscle, we put the two of those together, it's called the iliopsoas complex. But you also have, that stretch there really primarily targets those hip flexor muscles. However, when you go into the couch stretch, which is where you elevate the rear foot, you flex at the knee, two additional hip flexors, the rectus femoris, which is one of the quadriceps, and the sartorius, which brings all the adductors, they also act as hip flexors, but they're hip flexors that go across two joints. So they go across the knee and they go up across the hip joint. So when you do that first hip flexion stretch, and you just push the hips forward and extend the hips and try and stretch out the front of the hips, that's good for those first two hip flexors. But then to get into those bigger ones, the rectus femoris and the sartorius, flexing the knee up behind so you stretch the muscle at the knee joint as well, will get in even deeper into those hip flexion muscles. So the point of doing the hip flexion stretches is that you can combat the anterior tilt of the pelvis. So when the pelvis tilts anteriorly, it forces the lumbar spine to compensate and shift anteriorly as well. And when the thoracic spine is more sitting in a posterior position, there's a lot more shear force around the lumbar spine. So that's going into a little bit of depth there, but the motto of the story is that if you are sitting all day or you have generalized non-specific lower back pain, do the hip flexor stretch, do that couch stretch. And you can recommend that to the guys that are sitting around you in the office, or if you've got clients that are doing EP programs, ask if they've incorporated a hip flexor or a couch stretch and see whether they have any success with that. So have fun with it and let me know whether you have any good results.